Hello, I'm Dr. Robert LaLouche, board-certified OBGYN physician with over 30 years of clinical experience. Today we're going to talk about the advantages of breastfeeding and some of the disadvantages. So, I'm sure you've heard that breastfeeding has some benefits. We definitely encourage it. As a physician, we will support you as a patient, whether or not you decide to breastfeed, but it's helpful for you to know some of the benefits and also a few of the drawbacks. So one of the immediate benefits of breastfeeding is that you're giving great, perfectly designed nutrition for your baby, and babies that are breastfed get some passive immunity. So when you get an infection, you develop antibodies and you pass those antibodies on to the baby, and they have less colds, flus, earaches, viruses in the first year of life. Very effective. It also reduces your personal risk of breast cancer by as much as 50% or a little more if you breastfeed for 4 months or more. If you breastfeed for up to 6 months or more, it reduces your chance of having diabetes in life and reduces your child's chance of having a weight problem as an adult. Lots of women are interested in getting their weight down, which is normal for it to go up when you're pregnant, and breastfeeding burns 500 calories a day, so it dramatically assists in your path to getting back to a healthy weight. In addition to the reduction in your risk of breast cancer, new evidence suggests that it reduces your risk of ovarian cancer, so lots of benefits. At first, it can be a little bit more difficult, more challenging, and over time, though, the challenge gets much less, and most women have said to me that after about 3 weeks, it becomes pretty easy. Most women say there is some discomfort at first. There are women who support breastfeeding and say if you're doing it right, it's not uncomfortable at all. But my experience with my patients, there's some say that it is uncomfortable at first, others say it isn't. Some say it's always a little bit uncomfortable. Others say you get used to it and it gets fine. So I encourage you to try. If you breastfeed for just a few days, you give your baby the passive immunity. If you can't do it, it's too uncomfortable, it's just not for you, then you gave it a try and your baby gets that health benefit. And if it works out for you, saves you money, after a few weeks, you'll be able to pump, and then you can give it to your spouse, the extra milk, and then they can wake up and feed your baby to give you a little bit more rest. So lots of benefits for it. If you are unsuccessful, it doesn't work out for you, we're still there to support you, and formula has plenty of it's a good substitute. It isn't as ideal as breastfeeding, but there's no value in you feeling guilty if that's just not right for you. Some women find that pumping is much better than directly breastfeeding their baby, and that's always fine as well. And there is a whole La Leche League. There's support at your hospital through your network to help you with any of the issues that you might encounter. So we encourage you to get more information, get the help, get support. And most hospitals have whole support staff that are there to answer your questions and guide you through. So I hope you found this useful, and please leave your comments. Thank you.